According to the research conducted by World Health Organization in 2020, 7.8 million women globally had breast cancer, with a recorded death over 680. In 2020, breast cancer deaths in Uganda reached at 1,128, making a percentage of 0.8%. With this statistics, experts base the increase on poor diet and lifestyle.
The more fat you eat, and the more high-calorie food you eat, and high-calorie food, I mean food that you cannot use, and burn completely and convert it into fat. And this is rice, this is posho, this is sweet potato, this is meat.
Dr. Mugisha Noreb from Uganda Cancer Institute says, although the cases of breast cancer are on increase, the issue of attaining proper medication and guidelines are key.
And because our patients come late, the survival rate for breast cancer in 5 years is now 51%. Now 51% is so dismal that you know that 49 of every 100 women that come to us, or men with breast cancer, will die in 5 years. That's not a good scenario to have and embrace.
Akelo Caroline, who has lived with cancer for now 2 years and is on medication from Uganda Cancer Institute, is a living testimony after following instructions and treatment from doctors.
So my advice to ladies out there, if you notice something in your breast, please do not take it lightly. It may or may not be something serious, but it's important to get to the root of it before it's too late.
But there are signs that will give you an indication that the breast is having issues. The nipples in a woman, when you undress, the nipple should come out clearly, whether you're a young woman or an old woman. But if the nipple retracts, pulls inside, then that's not a good sign that something must be inside, pulling it inside.
With the aim of addressing cancer, especially breast cancer, Uganda Cancer Institute, together with civil society organizations in the fight against cancer, are developing breast health care guidelines.
So the reason why we are developing these guidelines, we want to make it easy and possible for every Ugandan who has a breast condition to receive the right care from the right person.
Stakeholders are optimistic that, with the developed guidelines, there will be a reduction in breast cancer cases in the country.
Doctors have developed guidelines in the past, and they only kept in clinics, and they are kept in shelves. But we are trying to make a guideline that has a patient voice, that has an advocate on it.
The guidelines, which are now discussed by stakeholders for 3 months, will later be approved by Ministry of Health. Deborah Namamonde, Aisha Nakazi, UBC News.